This presentation is on special needs dentistry, with a focus on autism spectrum disorders. What is autism spectrum disorder, or ASD? It is a neurodevelopmental disease, which begins early in life. It is typically diagnosed around 3 years of age, but can be overlooked. ASD has an unknown etiology, but recent research suggests there may be a correlation between certain gene presentations and the disease. However, further research is needed. Poor eye contact, inability to read facial expressions, difficulty with social norms, and difficulty with appropriate peer interactions are signs of ASD. Difficulties in communication can vary from severe nonverbal cases to simply not being able to indicate emotion through tone of voice. Restrictive repetitive behaviors are also a symptom of autism. Autism is called a spectrum disorder because it has many faces. If you've met one person with autism, you've simply met one person with autism. We have to remember each person with ASD is unique and individualized. They can express love, desire community, are typically not dangerous, and especially in a clinical setting, we need to remember that they can hear you, even if you cannot hear them due to nonverbal aspects of the disease. The concept of autism has been circulating through psychology since 1911. In the 1940s, Dr. Leo Kanner redefined autism as a behavioral and emotional disorder in children. In 1980, a formal diagnosis was published in the DSM-3, which is like Wilkins for psychology. Researchers are now focusing on the plasticity of the brain at a young age and possible treatments and diagnostic tests surrounding that concept. The DSM-5 in 2013 introduced the diagnosis of ASD in a new way. The DSM-5 has 3 levels for autism. Level 3 is the most severe, and Level 1 is the most functional. Why is ASD an important topic relevant to dental hygienists? According to the 2014 National Health Interview Survey, 1 in 45 children aged 3 to 18 are diagnosed with ASD. These numbers have risen twofold since 2010. As healthcare providers, we can make a difference by individualizing patient care and staying up to date on new information. This can help break down one of the walls that is built around access to care for people with ASD. A research study by Khatib et al. Titled Oral Health Status and Behaviors of Children with Autism Spectrum Disorder showed that children with ASD have poorer oral hygiene when compared to children without ASD, and parents reported less access to care as well. Parents of children with ASD and without ASD predicted cooperation and acceptance of behavioral treatment options as well. The graph to the right shows the results of this. A research study, which included a parental questionnaire and a clinical examination, was done by Khatib et al. Entitled Oral Health Status and Behaviors of Children with Autism Spectrum Disorder. This study found that children with ASD have poorer oral hygiene when compared to children without ASD. And also, parents of children with ASD reported less access to care than children without ASD. Parents of children with ASD and without ASD predicted cooperation and acceptance of behavioral treatment options. These are shown in the graph to the right. When treating children with ASD, it is important to know what common oral problems we may face: bruxism, non-nutritive chewing, tongue thrusting, self-injury, erosion, xerostomia, and hypergag reflex are all seen in children with ASD. As clinicians, we also need to be aware that sometimes when a child has severe ASD, they will not be able to verbalize pain or sensitivity or unmet dental needs. Lay et al. Conducted a research study on the unmet dental needs and barriers to dental care among children with autism spectrum disorders. Out of the participants in the study, 93% of children with ASD had been seen by a dentist. However, 11% still had unmet dental needs. The three main barriers to dental care among children with autism spectrum disorders included behavior, which was the most significant, cost, and lack of insurance. Behavior was a barrier due to the unknown or known reaction of the child, as well as fear that the healthcare providers would be inexperienced in working with a child with ASD. This is where we can show up in a big way for this population. There are endless combinations of methods and alterations which can be easily attained with minimal cost in the dental setting. Practicing behavioral management techniques is one way to achieve successful dental visits for patients with ASD. Tell, show, do is a practice we have been exposed to from day one. This allows the child to not only hear instruction or descriptions, but also see an example and have a hands-on experience. Desensitization is a management tool which enables the child to become acclimated to his or her surroundings. For example, in order for the child to become comfortable with the dental chair, they would come into the office for a short 1 to 2 visit, simply to stand in the same room with the chair. The next visit, the child would get to explore the room and the functions of the chair, and be encouraged to sit in the dental chair for 30 seconds. The time increment would increase with each visit until we reach a full appointment block. It is also important to speak to the patients with ASD in a calm, even tone. This is no different than how you would speak to a patient with any level of dental anxiety. An example of applied behavior analysis will be explored in a moment. Home-based prep is practicing the steps of a dental visit at home using a flashlight, dental mirror, and toothbrush. We should encourage parents to do this before dental visits. This will help the child feel comfortable once in the dental chair. Positive verbal reinforcement is simply encouraging the child and affirming that they are doing a great job throughout the appointment. Distraction can be attained through music, video, or even a favorite toy. Sometimes parental presence makes the appointment tough because the child looks to the parent for instruction instead of the healthcare provider. However, sometimes parental presence is the best solution to anxiety or behavioral problems. Sensory techniques will also be discussed in just a few minutes. Social stories describe the practice of describing the dental visit through a friend, fictional character, or relative's experience. The book, Leela Goes to the Dentist, is a great example of this management technique. Visual schedules are also a great tool. An example is located in the picture on the right. Each picture represents a certain part of the appointment. This can provide a sense of security for a child with ASD because they know what to expect. Protective stabilization will also be discussed later in the presentation. Nitrous oxide, conscious sedation, and general anesthesia are also possible treatment options. Many children and adults have issues with sensory processing as a symptom of ASD. Many sensory techniques can make the appointment more comfortable. Just remember, every individual with ASD is different and may respond differently to techniques presented. This slide details possible sensory triggers that may produce an unwanted reaction in children or adults with ASD. Reaction to motion, reaction to touch, reaction to sound, reaction to visual stimuli, and reaction to smell and taste are the main categories for sensory processing. Protective stabilization is a technique that allows the patient to be restrained in a protective manner. Examples of protective stabilization include papoose boards, active immobilization by another person, body wraps, and hand restraints. These should not be used as punishment in any situation in the dental office. They should also not be used on children who have been physically or emotionally abused. Protective stabilization has been a controversial treatment option. However, when used correctly, can prevent self-injury as well as injury to the clinician. According to a study by Lay et al., parents who use or had previously used protective stabilization were more accepting of the practice. This is due to the positive results that the parents had with this type of intervention. Preparing the office is another strategy which is very important when a patient with ASD is coming in for a visit. Parent surveys are a great tool to utilize to ensure that the dental team is aware of any triggers or any special needs of this specific patient. A few ways to prepare the office include dimming the lights, turning down loud noises, and removing clutter. Also, after the child arrives, demonstrating instrument sounds before beginning the appointment and communicating with the child clearly and accurately are very important to a successful appointment. Always try to end the appointment on a positive note. Children are very perceptive to your reactions and your attitudes towards them. So maybe offering some encouragement and even a nice reward would be a great way to end your appointment with your ASD patient. According to the website Autism Speaks, there are two main effective ways to present oral hygiene instruction for parents and caregivers depending on the severity of the child's ASD. The ABA approach, which stands for Applied Behavior Analysis, is where you break down the oral hygiene routine into very simple steps. Every time a step is mastered, a reward should be given and the next step should be added to build onto the next. An example of how simplified you should go with the steps include get toothbrush, get toothpaste, squeeze toothpaste onto toothbrush. Extremely simplified. The second technique for oral hygiene instruction is to have the child stand in front of the parent and lay the head on the chest of the parent. Parents should brush the child's teeth as they would their own. Brush by sextant and always go in the same order and same pattern. Also floss the same way, making sure to treat each tooth individually. Oral hygiene aids such as the Dent Trust specialty toothbrush, bite sticks, or electric toothbrush could positively aid home care. So let's take what we've talked about a little bit deeper. What is your opinion on the use of protective stabilization in the dental office for children with ASD? What techniques would you try before using protective stabilization? Also, when referring to the sensory processing, what steps do you feel you could take in a dental office to prevent a child who has severe sensory processing issues? They are reactive to every single sensory stimuli. What would you do in that appointment? To summarize, autism, once again, is a neurodevelopmental disease that is characterized by difficulties with social interaction, communication, and restrictive repetitive behavior. It is a spectrum disease which means there are different levels of this disease. ASD is an individualized disease. Common oral complications are very important to recognize for us as clinicians. Children with ASD may have poorer oral hygiene than children without ASD, so oral hygiene instruction and encouragement to adherence is very important in our career. Options are endless when it comes to tailoring an appointment to fit the needs of a specific patient with ASD. Find out what this patient's individual needs are and try to meet them as best you can. Thank you for listening and good luck with your first ASD patient.